Hello, everyone. My name is Nicole Minner, and I am currently a student at Delaware Technical and Community College. I am majoring in nursing, and I am taking the class Ethics of Healthcare. And one of the research paper topics that I chose was assisted suicide and euthanasia. So, assisted suicide is pretty much suicide um, by a patient who is suffering from a incurable disease. And what they're substantially doing is asking for a healthcare provider to administer or to provide them with medication to end their life or end their suffering. Now, euthanasia is where a doctor actually gives you the medication. It's pain free, and they are ending your life for you instead of you actually taking the medication. This particular euthanasia topic is illegal in most countries, except for a few. So the reason why I selected this topic is because I want to be a hospice nurse. I currently volunteer at Delaware Hospice in Milford, and I witness a lot of patients who are suffering and dying and are in pain. Um, the difference between this is palliative care and hospice do provide you with tons and tons of medication to make you feel better. Um, but I like this particular topic because I feel that this should be allowed. You want to end that pain and that suffering. The issues that I addressed in my research paper would have to be that this particular topic has been in a debate for a couple hundred years, since the 1800s. A lot of people feel that it is your freedom of choice to die that way. Quality of life has to also go with this topic. So if you're dying and you're in a lot of pain and you're causing your family all this anguish, you kind of want to free yourself from that pain and no longer put yourself in suffering, and also suffer your loved ones or have them suffer for you. A lot of people also agree that you want to die with dignity. You don't want to have someone take care of you and wash you and do those things. You want to be able to have the choice to take care of yourself. So, the reason why I decided to choose ethics as my topic is because of my code of ethics that I would want in nursing. So, as part of my code of ethics, a good nurse would show sympathy to a patient. And if you have sympathy with a patient, you also have a great relationship, and you wouldn't want them to be in pain and suffering. You want them to be pain free. Also, you have an obligation to take care of them and to be by their side. So, I chose assisted suicide and euthanasia because of this. I want to be able to be there for a patient who decided to choose that route, but also would be there with them to hold their hand or to make sure that they're comfortable. Now, this research paper, I learned so much. I was familiar with Dr. Kevorkian, but I did not go into a lot of depth and research on his whole career. So I learned about his first assisted suicide, which was with a woman in Wisconsin who assisted. He assisted her. He was unable to find a facility to actually give her the medication, this machine, this suicide machine. So he ended up setting up a bed in a van and was able to give her a lethal dose to end her life with her pushing the button. So I also learned that the main reason people are against assisted suicide and euthanasia has to deal with the Hippocratic Oath. So go back to the 1800s, where every doctor took an oath. And in that oath, he says, I will neither give a deadly drug or be asked for one. And that was the main thing that I learned doing this paper. I really enjoyed learning about the research and what countries actually do euthanasia. So you have Belgium, you have the Netherlands, um, and actually, I believe they just. Um, it was just allowed in Oregon, which is in the United States. So I just want to thank you all for listening to my research paper topic, and thank you very much. And I hope you have a great evening. Bye.